be able to participate in this welcome ceremony, even if it is by screen interposed. And I'm very happy to be able to contribute to underline the importance and the interest of this Congress, which addresses so many and so different aspects of pain, and which brings together so many relevant colleagues, some of whom are almost daily companions of myself at EFIC, and others whom I have not seen for a long time and would have liked to meet again. Organizing an event of this magnitude is not easy in any country, and I'm sure that it has taken an enormous amount of energy of quite a few people from the local committee. I know at least two of them who have been on the forefront distributing energy. I know how one is Ene Amil, and naturally Professor Apostol Vaso, the Counselor of the Albanian chapter of the European Federation. That their work be adequately recognized, as well as the work of the other members of the Albanian Society of Pain, seems fundamental to me at the beginning of this Congress. Multidisciplinarity is at the very core of the European Pain Federation. And I'm also extremely happy to see that the program that has been endorsed by EFIC approaches different pain domains from very many points of view, not only with basic and clinical science, but also with lectures on system neuroscience, theory of mind, cognitive science, anthropology, and classical philosophy. This should remind us that in classical times, times that we sometimes disdainfully call as pre-scientific, the experience of pain was not considered just a sensorial experience, but rather a passion of the soul. Now we can laugh at that, of course, but I think that would be probably mistaken if we did so. Because just change the word passion to affective state, and change the word soul to high order prefrontal networks. And you'll be diving into very modern concepts of how pain is experienced and modulated in the conscious brain. Among the many themes that are treated in this conference, phantom limb pain is one of the main protagonists. It's bodily pain in an absent body part. And phantom limb pain constitutes one of the enigmas of pain neuroscience, which divides the community of clinical and experimental scientists, pain, between those who defend theories based on central spinal and cortical reorganization, and those who consider that phantom limb is a purely peripheral mechanism prior to the entrance in the spinal cord. And those among whom I count myself, who privilege a multifactorial pathophysiology involving interaction between the central and peripheral nervous system, plus psychosocial factors, and of course, genetic influences. In any case, phantom limb continues to challenge even the most sophisticated and multidisciplinary management. You all know that. And while it is probably doubtful that the problems it arises be all resolved after this Congress, I'm sure that the discussion, the debates that you will have will contribute with a further step further to resolve or to improve the management of this terrible load. So in the name of EFIC and in my own, I wish you a very successful Congress, full of lively discussions, full of emerging ideas for the benefit of our patients. Welcome, and thank you very much.